Welcome to the 2020 Women's Giving Circle Annual Project Awards meeting. I think this is probably the most exciting day and maybe the most important in the year of the Women's Giving Circle. And I want to welcome all of you, all of our existing members, and especially our new members. And I don't know about you, but I'm so glad to be with my Women's Giving Circle friends and members, as opposed to being home watching the news on the election. So let's enjoy this time while we can and get on with the meeting. A few logistical items. Everyone's on mute throughout the meeting except for the speakers. We're also not able to see you today. You're only able to see the presenters on your screen. If you have any questions or want to make any comments, please click on the Q&A box at the bottom of your screen and type in your question. One of the staff members will address those to answer during their comments. So, as you know, we'll be hearing the results of our voting today and learn which projects we will be funding. I want to make sure that everybody submitted their ballots. So if you're participating today and you have not voted, please use the Q&A feature to let us know. Pat Cochran can then send you the link to the electronic ballot so you can quickly cast your ballot now. So, since 2004, the Women's Giving Circle has funded more than 160 projects and invested over $500,000 to build and strengthen hospice programs that provide care and comfort to patients and families in their lives at the end of life. The projects have touched all areas of care. And as we gather for this annual meeting, please remember that your membership made moments like these possible. A patient in the inpatient unit is able to stay there, even though their insurance will no longer pay for their care. A family can make a forever memory keepsake with their dying child. A veteran patient is feeling proud and wiping a tear from their eye as they're being pinned and recognized for their service to our country. These are just a few examples of the impact that you make every day at hospice and community care. I thank you for your continued membership during this difficult year. And while we have all felt the effects of the pandemic, hospice and community care has cared for a record number of patients, sometimes being the only hospice provider that is willing to care for COVID patients. Our community needs this organization now more than ever. Now let's get on with the program, and I would like to introduce our chair of the membership committee, Adele Terwilliger. Adele?
Thank you, Kelly. Good afternoon, everyone. Glad you could join us. Currently, we have 164 members of the Women's Giving Circle, which will allow us to give $82,000 in grants today. Despite this difficult year, we continue to grow membership. Of the 164 members, 20 are new members and 144 are returning members. Our York membership continues to grow this year as well, with 21 of our members residing in the York community. We are sharing the list of all members on your screen, but I would also like to recognize our newest members of the Women's Giving Circle. Typically, we would present you with a Women's Giving Circle pin today, but given that we are meeting via Zoom, we will mail your pin to you. I apologize in advance if I mispronounce your names. Our new members in 2020 are Renee Aquilina, Jeanette Bontrager, Pat Buser, Valerie Clark, Kathleen Cooley, Susan Grable, Joan Harold, Jane Higdon, Erin Holtzapple, Lynn Keller, Michelle Lando, Rebecca Link, Annette McKinney, Brenda Neff, Anna Rochelle, Audrey Slater, Joan Terwilliger, Dorothy Theros, Mary Veach, and Pat Walters. Welcome to the Women's Giving Circle. We are so pleased that you have joined us. Now, I'd like to introduce Steve Knaub, Hospice and Community Care's President and CEO. Thank you.
Well, hello, everybody. Thank you all for joining us today. And much more than that, thank you all for continuing to support our organization. As it was said earlier, it's needed more than ever right now, and your continued support really means the world to us. So I know many of you have seen the presentation that I did earlier this year and talked a little bit about COVID-19 and the impact onto us. But I wanted to share a little bit more about that and update you on a few things since then. And I apologize for part of this will be a repeat for some of you, but a lot has changed since the last time we talked too. So to say the least, it's been a hugely challenging year for all of us. I have now been with us. Okay, Pat? To say the least, like I said, it's been a huge challenge for all of us. And I've been with the organization now for 22 years. And March and April were clearly the toughest months out of all 22 years by far. We needed to make life-threatening decisions every day with very limited information. And that was really tough on everybody. Most of our early discussions revolved around how we're going to provide patient care. You heard not every hospice had that. Some hospice said they're not providing patient care in some cases. We just had to figure out how we were going to do it. And of course we did. A lot of the early discussions evolved around staffing and volunteers and a couple aspects. Can we keep everybody safe? That was the #1 priority, making sure our staff stay safe. And the other side is, will we have staff? There were so many unknowns at the very beginning. And what if a significant portion of our staff goes down? How are we going to take care of these patients? But we've come up with new policies and we're able to meet the needs very well. Finding protective equipment. The personal protective equipment you hear about and the challenges were so real and still is. Right now, we're fairly well supplied. Adequate, I think is the word to use. Concerning for the future, but making sure we can keep to have that. And so far, we've done okay with that. And working remotely, having our staff work remotely when we weren't used to doing that. And our IT department, which many of you know well from presentations, did a remarkable job getting everybody able to work remotely very quickly, and all of our clinical staff not having to come back in the office very often. We heard in the presentation earlier this year about the COVID-19. The team that volunteered, I think that's the key word, volunteered to take care of those patients. And that's pretty amazing when you think about all the unknowns at that time for them to say, we want to do this, we want to help. I think it's great. And inpatient center. Inpatient center was a lot of our discussions early on. Now, you might remember we can't take care of positive COVID-19 patients in our rooms there because we do not have negative pressure rooms. But the staffing levels and staffing concerns were top priority again, keeping all of our staff safe. And it's a challenge for there because we have 24 patients in there, as many as. We have to make sure we're available 24/7 to take care of all of them. So if we reach a staffing crunch in some way, how are we going to manage that? And visitors. We had multiple long discussions on what types of, how many visitors, or if we're going to allow visitors in our inpatient center. And that was some tougher discussions because we had to allow visitors. There's just no way we can tell family members and husband or wife of 50 years, no, we're not going to let you in there at that time. We had to put in precautions to do that. And even today, our leadership meeting just yesterday had significant discussions on what type of changes we could do over the holidays and things like that. And also Good Drive. What about the 12 beds we have here on Good Drive that are not being occupied right now? We don't have the staff to take care of additional patients in here, but we want to help our community healthcare systems if they have that need. And we're still even looking at that potential with the rise in the number of cases lately. In total, so far for us, we have taken care of, I think the number I saw yesterday was 208 COVID-19 positive patients. Surprisingly, we're really not seeing an increase in the numbers here with this rise. We're consistently right now around 5 patients a day on our census that are COVID positive. So we're not seeing that huge spike, pretty consistent for us. Out of our 425 total staff that we have on board, we've had 14 staff that have either tested positive or are presumed positive for the whole year so far. That's pretty remarkable and low numbers in healthcare. And we had a period of about 12 weeks where we did not have any additional staff test positive. So as of Monday, as of right now, this coming Monday, all will be back to work and working in our back 100%. So meanwhile, while all this is going on, our mission still goes on, but we have to find new ways to basically do almost everything. Caregiving, how we're actually providing that care and doing that looks totally different now. Finding staff. So as you'll hear about the increase in the number of patients we're taking care of in a minute, we have to find staff during this crisis and find new ways to get them. We've been fortunate, but we still do need additional staff. Billing insurance companies all looks different. Training of our staff, how we social distance and train new staff that are hired is a huge challenge. Providing our grief support looks entirely different right now because we're not having any groups in person, how we turn that into the social side of things. Working in nursing homes, how we're providing palliative care, everything has changed. And of course, raising money has also changed. So in other words, pretty much everything we do has changed in some way or another. But our strategic focus really does remain the same. We are still concentrated on the same 4 main areas you heard before: staff, quality, financial stability, and growth and access. And I wanted to mention about each of those, but I'm going to go sort of out of order here and start with the growth and access first. This is how we meet our mission. Are we continuing to increase our outreach? Most hospices throughout the country right now have seen drops in their patient numbers, but not us. We have seen significant increases, just the opposite. I'll save you from all my slides that I usually show you every year, but the former CPA in me has to share at least a few numbers. At the end of the first 3 quarters of this year, our hospice, just hospice census, was 493 patients per day versus 441 last year. That's an increase of 52 patients per day, or a 12% increase in our total number of census, which is really amazing. That included numbers for York census. Last year, we averaged 96 patients a day. This year, we're averaging 117, so significant increases there. Our hospice numbers for the inpatient center look a little different. Last year, we averaged 19.9 patients per day at our center, just shy of the 20 mark. This year, we've seen a huge drop. We're caring for 17.9. That's 2 patients per day drop. Now, that sounds small in many ways, but 2 patient per day drop has a huge financial impact. A 1-day swing in our inpatient center equates to around $264,000 a year. So that 2-day drop is basically a cut of $500,000 to the bottom line. And the drop's understandable. I mean, we certainly, anybody who can avoid going into a facility, hospitals, nursing homes, hospices, and you have caregivers more likely at home now that are able to maintain those patients at home, we certainly understand. So that's a normal drop, but it's certainly impactful. Our supportive care average daily census was 83 patients a day last year. In 2020, it's up to 90. And right now, that's per average. Right now, we're over 100 patients a day on our supportive care program. And palliative medicine consultants continue to look much different this year because they follow the census much as the hospitals. And when hospitals were 50% capacity, we had a much different PMC seeing of patients early on. Now our staff are consistently seeing more than 50 patients a day on most days. And our Pathway Center for Grief and Loss, those numbers have gone up as well. Of course, that support looks so much different now, but we're finding ways to continue that support. In total, March 1st, we were caring for 564 hospice and supportive care patients. On July 1st, we were caring for 571. So really from March to July, it stayed pretty small increase, but an increase where others were seeing drops. But on August 4th, we jumped to 650 patients. That's an all-time high. So that's 79 additional patients in only 35 days. That would mean basically we would need additional 7 RNs just to cover that increase, plus aides, LPNs, social workers, chaplains, and others. So that's great for patients that they're getting our services. That's great for businesses and meeting our mission, but that is tough on our clinical staff to see that kind of increase. Right now, our hospice census is running into 630s. Today it was 640, almost right up at that high level. And it's been hanging pretty steady over the last 3 months. So from a growth and access perspective, we have really grown. So back to those other areas and staff, our top priority. If we don't have the best staff, we can't provide the best care. It's been an interesting year for all of our staff as well. And take a second to think about our direct care providers from their perspective. They're walking into homes that may or may not be taking proper precautions against COVID. They are providing care to patients and family members that may be known COVID positive patients, or in most cases are very sick, and we really have no idea because they've never been tested in any way. Our inpatient centers, they are caring for new patients and families and each and every day coming in and throughout that. So they are in a very challenging spot. We did the best places to work survey again this year. We usually do it every 2 years, and we have a supervisor survey we do in the off year, but we felt it was made sense for us to do that again this year with everything that's going on. We didn't make the top list of top 100, but we ended with a score of 87. That 87 score is the exact same score we had in 2008 when we were named the 10th best place to work in the state. So we're very proud of those numbers. I know that there's been a lot of changes in that survey process, but we're very proud of that. Our turnover has also been fabulous, which thank goodness for that. Preventable turnover is projected at 4.1% this year. That's the lowest in the last 10 years and half of what it's been over the last 4 years. 4.1% preventable turnover is unheard of in healthcare right now. And thank goodness, with all the additional staff that we need to hire this year, that's super. But, and there always seems to be that but, we have seen our largest amount of staff retire this year. Last year, we had 4 staff retire. We're looking at 13 this year. And honestly, who could blame them? I'm sure most staff that are counting the days in retirement in general had to question that this year. And I think most of us are jealous in that way. Quality is another top focus area. And I'll say the same thing I said last year. We need to get better in some areas. There's such a lag. We put in a lot of new efforts and things to continue to focus on and reach better numbers and better impact to our patients. But it takes a long time before you see the results of your efforts till we get the survey information. Right now, the information we're getting back still is not anything for our COVID care yet. So we're really looking forward to see that. But 84% of our families completing the survey still rate us as a 9 or 10 out of 10. And the last area is financial stability. And what a crazy year financially. A year of rapid growth is great financially. You still have lower overhead. You're usually understaffed. So that's not good for the long run, not good for patient care, but good financially. This year, we have additional COVID impact on our cost. The PPE, the COVID testing we're doing, huge amounts of staffing time are costing us a lot of money this year. And the fundraising impact. We're projecting to raise $1.1 million less this year than we did last year. And then we have the CARES Act. I talked about that before. The money that came from the government that said no strings attached. I'm going to be leaving after I exit this call then, because there is a legal seminar going on right now that is talking about those no strings attached and all the strings that are truly attached to that. With that CARES Act money, we do expect to show a net income this year, which is really amazing in a year like this. So biggest concern still remains, what will fundraising impact be next year? And if anyone out there has a crystal ball and it's still working, please let us know what that is. A lot has changed this year. I sure hope we never experience anything like this again, but I think we also learned a lot. We're going to incorporate some of what we learned this year into our services when life returns to normal. We will use Zoom more, but I will tell you, I'm really sick of it. And I know I'm old, but I want to be able to look people in the eye when we talk. I think we're just missing out on so much. And I don't believe that lack of personalization is going to be good for us in the long run. We will incorporate more remote work in some way. It is working well for us right now. but it just can't be all the time. Teams need to come together. We need to have those water cooler conversations. And I'm not just talking about what my Ravens did last Sunday. I'm talking about, hey, did you see this was going on, kind of conversations that we all stay, more engaged. And we really want to bring that back when we can. So where we stand today, I'll just say again, our staff has been absolutely amazing. They are really top-notch and amazing people. Operationally, things are going great, really. I'm shocked in many ways how things are still running very smoothly. We are using more telehealth. We're not using telehealth to replace visits, though. It's not a matter of, well, let's do this so we don't have to go there. It's when we can't get there. If there are challenges in other ways, nursing homes specifically, we use telehealth to try to supplement that visits. And we're not making changes yet. A lot of organizations made a lot of changes come August and September. We knew this resurgence was very possible, and really nothing even changed back then. So we kept with our same precautions, and we're doing staff meetings right now, and I reminded our staff, we need to remain just as vigilant as we always have to make sure we all stay safe and keep those numbers down. I mentioned this when I met with you earlier this year, and I'll say it again. I have been part of hospice for 22 years, and I've never been more proud to be a small part of this great organization. So I'd be happy to answer any questions. I see there's nothing in the chat. I don't know if anybody in the room downstairs, I'm in my office now, has any questions, or Amy, how'd you like to handle this, or Dee?
He's talking to you.
I see two, but there you go. Sounds like that's working now.
Thank you for that brief intermission, Steve, and for your wonderful words about how everything is going right now. At this time, we don't have any questions, but I would like to introduce Sarah Young-Fisher. Sarah is the chair of the Proposal Review Committee for the Women's Giving Circle. Thank you.
So as Kelly mentioned, it's an exciting time. The most exciting part of being on this committee is that we get to figure out, or we vote on the projects, and then we get to find out what is funded. So right today, Amy said yesterday, 2 people joined Women's Giving Circle. So we have 164 members, as Kelly mentioned, $82,000 to give away. Isn't that exciting? So the folks who have been on this committee before, or this group before, know that we voted differently this year, that we voted for 10 projects and that we did not weight them. And so if you have an opinion or a question about that, please make certain that Amy or Dee get to have your opinion about that. So we tried, it was streamlining voting, and I thought it was cool. I voted online, and I thought that was pretty nice too. So I'd like to announce the projects that we have funded, and from it'll be number 1 down to the end. All right, they're going to put them up on the screen.
Just give us one.
That's right. And I've mentioned this before. I just think it's so exciting that we know exactly where our money goes. And that's one of the main reasons I like the Women's Giving Circle, because we know what we're funding with the money. Well, if you send a check off to another charity, you don't know where it's going and how it's being done. I also enjoy that it's a group of ladies that we have a good time when there's no Zoom, right? We still have a good time as it is. But, so they're working on putting up the projects.
There we go.
So the first one is the Extended Stay Fund. And so that is $12,500. And I think it's interesting that we vote for the same things every year because we know how important it is. The gift cards. And I'll continue on with this, but I wanted to explain to you all that the proposal meetings that we have in July and August are really something else, because we started out with over $200,000 worth of projects, and we have to come down to 82,000. So it's really amazing that certain projects are number 1 and 2 and 3 year after year. So the extended stay is first, as I said. Gift cards are second. The third is personal protective equipment. So that's a new project for us, and obviously it's necessary in this time. Clinical Care Special Needs Fund. And that was really interesting to me the first time that came before us, because of the extra expense that special needs people have, and the expense of the equipment. Ambulance Assistance Fund is the next project. The Patient Ready Bath Rinse-Free Shampoo and Conditioning Caps. My brother-in-law was in the hospital. He loved those. He loved the caps. The Clinical Care Recliner is next. The Medisets, which is wonderful and it makes things easier for people at home. The Supportive Care Symptom Management Kits is the next one. The Hospitality Cart in the Hospice Center at Mount Joy. Supportive Care Patients Grants is the next one. The Patient Fall Mats was the next project. We Honor Veterans is next. The Dementia Resource Tools is the next project that was funded. The Pediatric Memory and Grief Supplies is the next project funded. The Gone from Sight books, the 11th Hour, the booklets is the next one. And there was a little bit of money left over. So we are partially funding the CD Solutions for $3,953, and they asked for $9,500. So any leftover funds will be offered to the most popular proposal. The next one, as I said, right now it's Seating Solutions. So thank you, and here we have Amy. Thank you.
Hi, everyone. Just one more second as we get the video turned over here. Thanks for being patient today. Isn't this a fabulous year? And we're really grateful to you all for sticking with us this year. We had always planned to have 170 members for the Women's Giving Circle. For this year, that was our goal. We still ended, if you'll just give me 1 second, I think we're having a technical difficulty, and I want to make sure that we can take care of this. Thank you for your patience. Surprise, I am back. That is kind of the way this year has been going, and you all have been absolutely wonderful. Again, I'm Amy Lewis. I'm the Director of Philanthropy here for Hospice, and I just want to thank you again for your patience, as we all navigate and learn things like Zoom and how to do everything that we do on a daily basis over again, which has been, as you can see, a lot of fun. Secondly, I want to thank everybody who just stuck with us and continued to show their dedication to hospice and community care. As Steve mentioned, we're still doing a plethora of services for our community, to our patients, to our families, and you all are an extremely important part of making that happen. I continue to be inspired by you leaders in philanthropy. And finally, today, as we wrap up, I do want to thank the Women's Giving Circle members who serve as part of the steering committee for the Women's Giving Circle. They help mold and foster the decisions that are made by the Women's Giving Circle from a perspective of being members, which is something that myself and Dee are often not able to provide. So today you heard from initially Kelly Track. Kelly is the steering committee chairperson. and oversees the administration behind the Women's Giving Circle. Secondly, we just heard from Sarah Young-Fisher. Sarah's the chairperson for the Proposal Review Committee, and she will remain the chairperson for the Proposal Review Committee through 2021, as will Kelly. And then earlier today as well, you heard from Adele Twilliger. Adele is the chairperson for the Women's Giving Circle Membership Committee, and she will continue to remain the chairperson for 2 more years, I believe. Not able to join us in person today, but I'm sure she's out there in Zoom land, is Karen Morrison, and she is the chairperson for the Education Brainstorming Committee. Speaking of, there's one more opportunity to be involved this year before we wrap up the 2020 Women's Giving Cycle, and that is on November 17th at noon. We'll be hosting a Zoom brainstorming session where we'll be discussing what types of educational programs and in what formats those programs might be for 2021. And we invite everybody from the Women's Giving Circle membership to log in and be part of that meeting. Finally, I know maybe it was a little anticlimactic this year, hearing some of the proposals that were funded and having to do that via Zoom. But please know we'll be getting all that information to you in just a week or so through the mail and through the email, through email as well. So you can be expecting those, and you'll have the results. If you didn't get a chance to write them down quick enough, you'll certainly have those. If you're planning to join for 2021, you can still make a gift from your IRA through the end of this year. That would be a tax-free gift to Hospice and Community Care. You can make it till December 31st, 2020, and we can count that for your 2021 membership. Thank you all again for all of your support to the chair people, and apparently I have forgotten another group of Women's Giving Circle volunteers, I apologize, who've been a tremendous help this year as part of our steering committee, and that's our ad hoc members. Susan Bonnekemper, Lois Morgan, Cindy Hogan-Togler, and Rhonda Murphy have all served as ad hoc committee members, and many of them are going to be serving in 2021 as an ad hoc once again. So thank you again, ladies, for joining us today. Thank you for your commitment to hospice and community care. Thank you for your philanthropic spirit. And we can't wait to see you next year and hope that things are a little different then. So have a great year. Thanks so much, everybody.